Children's type by Douglas and Borland. A common constitutional type in children is Calcarea, usually Calcarea carbonica, but sometimes Calcarea phosphorica or Calcarea silicata are more suitable to the individual case. This leads to the consideration of phosphorus and silicea. It is useful to know the outstanding characteristics of these remedies and those that follow on. In association with the silicea types, consider also Sanicula and Aethusa. A little away from the strict Calcarea type is the possibility of Lycopodium, and following from that a further possibility of Causticum. Quite apart from the above, it is always wise to consider giving a dose of tuberculinum when treating children of the first group. In the second group, Baryta carbonica, the next drug to consider is borax, the same type of children with similar indications. This leads on to Nectum muriaticum, which in turn raises the possibility of sepia. This leads on to the drugs of depression, and one of the gourd sorts must then be considered, either aurum metallicum or aurum muriaticum. When dealing with a sluggish mentality or sluggish makeup, there is always a possibility that carbo vegetabilis may be called for. The third group, Graphitis, leads to the consideration of capsicum, and if dealing with any skin condition, the possibility that sorinum may be called for must be considered. Also, when dealing with children where there are definite skin indications, Antimonium crudum should be thought of, and although it is not really like the Graphitis picture, petroleum should always be remembered as a possibility. In the fourth group, Pulsatilla, there are also a number of possible drugs. After Pulsatilla, the first possibility is Colisulfuricum. And as in every sulfur compound, it is necessary to consider whether the case could be a sulfur type. When the mentality is very similar to that of Pulsatilla, one has to consider Thusa. And as soon as Pulsatilla-Thusa group is considered, it leads on to Silicea. In turn, Silicea always suggests the possibility of Floricum acidum. In dealing with hot-blooded patients, think of Bromium and Iodum. From iodum, with its emaciation and hunger, pass to consideration as to whether abrotenum may be called. In the fifth and last group, the nervy drug Arsenicum album heads the list with all its terrors. Terrors also suggest stramonium. Then comes the hypersensitive nervous system type, and chamomilla comes to mind, and then senna, which is little more violent. The strange digestive disturbances of senna leads to consideration of magnesia carb, reverting to the strictly nervy type. One considers the possibility of ignatia, and with this nervous restless fidgety type, there is always the possibility that zincum may be called for. The foregoing is a brief survey of various groups, and these are now considered in a greater detail.